The epidemic is far from over. We are in the middle of something really big.
It's unbelievable. I never have seen it before.
Au départ, les gens nous tapaient des bois et aujourd'hui, la communauté commence à comprendre.
Fortunately for me, I came through.
Since the beginning of 2014, West Africa has been facing the worst Ebola crisis on record. The deadly virus had already struck African communities, but never before had an Ebola outbreak reached such epidemic proportions and taken such a heavy toll on human lives, with thousands dead. Although the situation is improving and the rate of infections is diminishing in the 3 most affected countries, health workers on the ground know there is no room for complacency.
L'épidémie n'est pas terminée. Je ne pense pas qu'aujourd'hui on soit vraiment à risque de voir une explosion réelle des cas, puisque effectivement la réponse s'est développée et est capable de contenir l'épidémie. Maintenant, l'objectif, ce n'est pas de la contenir, c'est de la stopper.
Ebola has affected every aspect of our country. The economy has practically been decimated. Business has almost come to a halt. Our public health system is under significant pressure. We've lost over 200 years' worth of medical experience, with our doctors dying.
Since the start of the crisis, the international community, including the European Union, has mobilised humanitarian, political, scientific and financial resources. Altogether over €4 billion to help fight the disease. The EU and its member states have pledged over €1.2 billion, 414 million from the European Commission, to help the worst-hit countries eradicate Ebola and pave the way to sustainable recovery. This includes life-saving assistance to communities, as well as direct financial support to governments' budgets to maintain basic services.
We've had fantastic support from the international community. The EU has provided funding to several NGOs. The EU has also sent physical support in the way of vehicles, in the way of personal protection kits, in the way of medication, so the support has been fantastic.
In Sierra Leone, as in Guinea and in Liberia, the fear of Ebola forced schools to close their doors. But with the support of the international community and the efforts of committed teachers, students can still follow the courses on the radio, and steps are being taken to reopen schools again.
Schools have been shut down for almost a year, and we thought we needed to help our children a little bit. So this poem was very quickly brought together. I do meet people in the streets who tell me they're listening.
One student who is surely listening is Fatou Dabo.
Last year, October 17, I lost my mother through this Ebola. So my life has changed. I miss going to school. I miss my friends, my teacher.
Nos espoirs, c'est que Ebola nous a permis d'identifier certaines de nos faiblesses. Nous pensons qu'avec Ebola et avec l'assistance et l'apport technique que nous avons reçu, nous devons sortir très fort de cette expérience douloureuse.
Getting to 0 Ebola cases is a big challenge, but it's not the only one. It's also about removing fear, healing communities, strengthening the health system, supporting the agricultural sector, improving food security, reopening schools, and regenerating businesses and industry. The European Union, together with international partners, will stand by the affected countries in their efforts to get back on their development path and to allow people to enjoy a better life.
We are hopeful that by the end of March we should be able to get the children back into schools, because that would be a symbol that normalcy is returning.
Notre ambition aujourd'hui en Guinée, c'est d'abord de booster le système de santé guinéen. Et ensuite, faire en sorte que ce système-là soit beaucoup plus performant.
We will come through this. We have confidence in our country. We have confidence in ourselves. All we need is the support and the help to get us there, but we will get there.